Welcome to our educational video on how to protect yourself from sexually transmitted diseases, or STDs. In today's world, it's crucial to have the knowledge and tools to safeguard your sexual health. Whether you're just starting to explore relationships or have been sexually active for a while, understanding how to prevent STDs is essential for your well-being. STD stands for sexually transmitted disease. It refers to a group of infections that are primarily transmitted through sexual contact, including vaginal, anal, or oral sex. STDs can be caused by bacteria, viruses, parasites, or fungi, and they can have various symptoms or may be asymptomatic. Some common examples of STDs include chlamydia. 1. Caused by the bacterium Chlamydia trachomatis. 2. It is one of the most common STDs globally. 3. Often asymptomatic, but can cause symptoms such as abnormal discharge, painful urination, and pelvic pain. 4. If left untreated, it can lead to complications like pelvic inflammatory disease, PID, and infertility. 5. Can be treated with antibiotics. Gonorrhea. 1. Caused by the bacterium Neisseria gonorrhoeae. 2. Commonly transmitted through unprotected sexual intercourse. 3. Symptoms include pain or burning during urination, abnormal discharge, and in some cases, swollen testicles or pelvic pain. 4. If untreated, it can lead to serious complications, including pelvic inflammatory disease, infertility, and an increased risk of HIV transmission. 5. Can be treated with antibiotics, but antibiotic-resistant strains have emerged. Syphilis. 1. Caused by the bacterium Treponema pallidum. 2. Can progress through various stages, primary, secondary, latent, and tertiary. 3. Primary stage is characterized by painless sores, chancre, at the site of infection, usually the genitals, anus, or mouth. 4. Secondary stage involves a rash, flu-like symptoms, and swollen lymph nodes. 5. Latent stage has no symptoms, but the infection remains in the body. 6. Tertiary stage, if reached, can lead to severe complications affecting the heart, brain, and other organs. 7. Can be treated with antibiotics, especially in the early stages. Human papillomavirus, HPV, infection. 1. Caused by various strains of the human papillomavirus. 2. HPV is extremely common, and most sexually active individuals will come into contact with it. 3. Some strains can cause genital warts, while others are associated with certain types of cancer, such as cervical, anal, and throat cancer. 4. HPV vaccines are available to protect against high-risk strains and reduce the risk of associated cancers. 5. Treatment focuses on managing symptoms and preventing the progression of precancerous conditions. Herpes. 1. Caused by the herpes simplex virus, HSV1 or HSV2. 2. HSV1 is typically associated with oral herpes, cold sores, while HSV2 is associated with genital herpes. 3. It can cause painful sores or blisters on the genitals or mouth, along with flu-like symptoms during outbreaks. 4. The virus remains in the body and can cause recurring outbreaks throughout life. 5. Antiviral medications can help manage symptoms and reduce the frequency and duration of outbreaks. Human immunodeficiency virus, HIV, infection. 1. Caused by the human immunodeficiency virus. 2. HIV attacks the immune system, specifically CD4 cells, and weakens the body's ability to fight infections and diseases. 3. It can be transmitted through unprotected sexual intercourse, sharing needles, or from mother to child during childbirth or breastfeeding. 4. Early symptoms can resemble flu-like illness, but HIV can remain asymptomatic for years. 5. Without treatment, HIV can progress to AIDS, which is characterized by severe immune deficiency and opportunistic infections. 6. Antiretroviral therapy, ART, can control HIV, prevent the progression to AIDS, and reduce the risk of transmission. Hepatitis B. 1. Caused by the hepatitis B virus. 2. primarily transmitted through sexual contact or exposure to infected blood or body fluids. 3. It can cause acute or chronic infection, leading to liver inflammation, cirrhosis, and an increased risk of liver cancer. 4. Symptoms include fatigue, jaundice, abdominal pain, and joint pain. 5. Vaccination is available to prevent hepatitis B, and antiviral medications can be used to manage chronic infection. Trichomoniasis. 1. Caused by the parasite Trichomonas vaginalis. 2. Commonly transmitted through sexual intercourse. 3. Symptoms may include itching, burning, redness, and abnormal discharge from the genitals. 4. Can increase the risk of other STDs and complications during pregnancy. 5. Can be treated with oral antibiotics. Pubic lice, crabs. 1. Caused by parasitic insects called Thyrus pubis. 2. Pubic lice infestations can occur in the pubic area, as well as other coarse body hair, such as armpits and eyebrows. 3. Symptoms include itching, visible lice or eggs, nits, in the affected area, and sometimes a blue-gray coloration of the skin. 4. Treatment involves using medicated creams or lotions specifically designed to eliminate pubic lice. Scabies. 1. Caused by the Sarcoptes scabiei mite. 2. Transmission usually occurs through prolonged skin-to-skin contact. 3. Symptoms include intense itching, a pimple-like rash, and the presence of burrow lines on the skin. 4. Can be treated with prescription creams or lotions that kill the mites. To reduce the risk of sexually transmitted diseases, STDs, here are some preventive measures you can take. Practice safe sex. Use condoms consistently and correctly during vaginal, anal, and oral sex. Condoms act as a barrier and can significantly reduce the risk of transmitting or acquiring STDs. Get regularly tested. If you are sexually active, it's important to get tested for STDs regularly, especially if you have multiple partners or engage in high-risk behaviors. Regular testing can help detect infections early and facilitate timely treatment. Limit sexual partners. The more sexual partners you have, the higher the risk of contracting an STD. Reducing the number of sexual partners and practicing mutual monogamy with a partner who has tested negative for STDs can lower the risk. Communicate openly. Have open and honest conversations about sexual health with your partners before engaging in sexual activity. Discuss past sexual history, STD testing, and any concerns or symptoms you may have. This can help establish trust and ensure that both parties are informed and taking necessary precautions. Vaccinations. Vaccines are available for certain STDs, such as HPV and hepatitis B. Talk to your healthcare provider about the appropriate vaccinations and schedules. Avoid risky behaviors. Avoid sharing needles or other drug paraphernalia, as this can increase the risk of blood-borne infections like HIV or hepatitis. Additionally, avoid engaging in sexual activities under the influence of drugs or alcohol, as this may impair judgment and lead to risky behaviors. Practicing good hygiene. While good hygiene alone cannot prevent STDs, it can help reduce the risk of some infections. Regularly washing the genital area with mild soap and water can help maintain cleanliness. Consider pre-exposure prophylaxis, PrEP. PrEP is a medication regimen that can be taken by individuals at high risk of HIV infection. It can help prevent HIV transmission when taken as prescribed. Remember, no method is foolproof, and the only way to completely eliminate the risk of STDs is through abstinence. However, by adopting these preventive measures, you can significantly reduce your risk of acquiring or transmitting STDs. If you have concerns or questions about STD prevention, it is advisable to consult a healthcare professional. Thanks for watching. Please subscribe for more such informative videos.